Dr. Brian Bobb is physician executive and healthcare strategist who serves in a senior leadership role at WellStreet Urgent Care, where he helps advance health system partnerships and the integration of urgent care into the broader continuum of care. Board certified in family medicine and with over 20 years of experience in urgent care, Brian combines clinical expertise with operational leadership to improve patient access, care coordination, and healthcare delivery. Welcome to DX the Podcast, Brian.
Thanks. Happy to be here.
Yes, excited to dive in here. So we'll start right out the gates. We often talk about getting patients in and out quickly, but what makes you different is you challenge us to think about what happens after the patient leaves. So I love that's where we're actually starting our conversation today, is when the patient is leaving or after the fact. So in your mind, what does a truly smooth patient handoff look like, and how do you work to measure if it's successful or not in your clinics?
Yeah, I think a lot of it has to do with the patient should leave feeling confident in what their next steps are, the care they received, certainly, but they shouldn't have any guesswork. They shouldn't have any concern that they're not going to get better or that there's not a plan for that. Mm-hmm. And so I think, they have that feeling when they leave, and the way we give that to them is making sure that there's a clear plan. We know what their diagnosis was, or we know that they're going to need X, Y, or Z, piece to get to that final diagnosis. And so we want to make sure that those pieces of the puzzle are clear to them.
Yeah. And you can probably relate to this, as I would say as a family physician. It's like, I knew that I wanted to go into a place of medicine where I was either finding the answer or helping my patient on the pathway toward the answer. And it sounds like that's really the goal. Is we may not always have the final definitive answer in the urgent care space, but if we can get you on that pathway towards finding that answer, that's the next most important thing we could possibly do at that point.
Right. And it's just, urgent care has grown out of that primary care, and you've got plenty of people that come from the ER background and then from the family, and you've got some different kind of perspectives from each side of that. And I think you kind of nailed it. I mean, it's that knowledge that we may not be able to give you that final answer right now, but we've put you on the right path, and we're going to be able to make sure that you're shepherded along to the answer that you need.
Yeah, for sure. And I know that this is something that's really near and dear to you, is recognizing that clinicians maybe sometimes feel or come across as very isolated from one another, that loss of connectedness is really kind of prevalent in healthcare, that they might seem fragmented, or the journey might seem fragmented for the patient. So we see it everywhere. And I know that you are working hard to kind of change that culture, thinking about practical ways to kind of build trust, collaboration in your communities where your clinics are. And that's not just with specialists, but oftentimes it's actually with primary care providers and ERs. So we think about kind of what is the path forward for reducing this fragmentation, for making those experiences more seamless, and kind of what are some ways or examples that you've worked towards building bridges, trust, and lasting relationships within the arena of kind of your community of providers and physicians?
Yeah, I think, again, there's been this move towards, more and more single coverage, and you're the only clinician there. And then on top of that, you don't have the connection, as you just kind of outlined. Mm-hmm. So, I think it's a little bit different between maybe a PCP and a specialist. A lot of times the specialist may be seeking you out. They want your business. They want the patient to come see them. So it may be a little more natural. So it's a good place to start. You build those relationships by, being willing to take the 5 minutes to speak to somebody. You may have somebody in your office that does a lot of that for you, and then you just are able to kind of make the final connection. Mm-hmm. On the PCP side, I think there's a little bit more of at least a risk or concern about competition. Is this patient going to get back to their primary? And so I think when you start by laying that groundwork by following up with a PCP when you have a patient that's in your office that has seen them, and kind of giving them a short synopsis of what happened, or giving them a quick call, those sorts of things can kind of open the door a little bit. And then you're breaking down those barriers that you have. It gives you the chance to collaborate and to have somebody else outside of your little bubble to speak to about those things. I think on the emergency side, it may be a little bit more difficult to speak to the emergency physician or the PA, the nurse practitioner that's working there, because of their pace. Mm-hmm. But it's a little bit more about exploring what are the avenues, and is there a one-call system with the hospital that they work with? Is there a triage nurse that you should talk to? And then I think as you develop that, and they know that they're getting that information, and the patient, again, is having the benefit of that, then you start to have more of a likelihood that you develop some relationships with the clinicians themselves.
Yeah. So as a physician, you and I can relate to this as well. it's maybe a little easier for us to feel the confidence to pick up the phone and call. So what
Yeah.
kind of advice do you give to maybe newer graduates or those that maybe don't quite have that confidence to pick up the phone and call?
Yeah, I mean, first of all, my advice for you from a system standpoint,
Yeah.
and so maybe for the
Yeah.
physician who is supervising, is to breathe that confidence, right?
Mhm.
Like, you should make it very easy for your team to reach out to you. And then when they know that that's how an interaction with a physician should go, it makes it that much more natural.
So model that interaction.
Yeah, and I think then again, seeking out those opportunities when it's not an urgent or an emergent situation, when it's not maybe even patient related,
Yeah.
can help to break those barriers down. So again, it's just making those connections.
Yeah. Building that confidence
Yeah.
step by step for
Yeah.
sure. Yeah. So we did talk a little bit about referral networks and kind of it doesn't happen by accident, it happens by intention. And so, really intentionally making those connections, those conversations, those calls. And really, patients don't just navigate the healthcare system, they actually help reveal how well it's working or not. And this is kind of a topic we touched briefly on before, even today. So, how do you use what your patients tell you to decide who you're going to lock arms with in the community?
Yeah. Yeah, I mean, I go back a lot to, and I'm sure we all had that in training where you had a mentor say to you, if you just listen, the patient will tell you what's wrong with them. I think that applies to what their experiences are outside of what might be going on from a medical standpoint. So, if you listen to them enough, they'll give you the cues about a really good experience they had with the orthopedist that they saw the last time or the cardiologist that you sent them to. So I think using that both with the patients and then also when you have somebody who comes by and they're looking for your business, I mean, you can
Yeah.
pick up a lot from what the interactions are with the patient or with the with the specialist who might drop by. I mean, how do they treat your team?
Mhm.
Are they only focused on you as the clinician, or do they interact positively with the person up front who
Sure.
opened the door for them? So I think using a lot of those cues is really helpful.
Yeah.
And then I think, and the other thing that we talked about is, it can be overwhelming to think about all the things I need to do to make sure that this patient gets from point A to point B and gets taken care of.
Mhm.
And it's, don't let that be a barrier. Start with something. Take a few minutes to do one thing with one person, and it'll build from there.
Yeah.
And I think that's the other thing is just it's really. I mean, you think about it when you're setting up all of your shortcuts in your EMR.
Yeah.
Man, how long did it take me to get here? How did you get all these setups? Like, well, you just build it
One
one little
step at a
piece at a
time.
time. And that's what you're doing with these relationships.
Absolutely. Yeah. Well, it sounds like you've definitely spent your career building these trustful relationships. So, if you could leave our listeners with one underrated skill that comes to mind that will make their professional and personal relationships better, since you've done a lot of work around relationships, what would that recommendation be?
Probably not a surprise based on my last comment, but I think it's just listening. I mean, it really is. I mean, we are in, especially in urgent care, but in medicine in general, speed is of the essence. Everybody's trying to move fast. Just, taking a few minutes to listen will probably save you much more time in the long run. I mean, if you want to be skeptical or cynical, it will take you a lot more time to deal with all of the things you have to unwind from a patient having a poor experience because they didn't feel like you connected with them or those sorts of things. But I think on the positive side, you take that few minutes, it rewards you. All the things that lead to burnout have a lot to do with us not making connections with people and being isolated. And so I think just take that few minutes to listen and kind of close the mouth for a second.
Yeah, it's hard to do.
It is. And we have to remind ourselves all the time. I mean,
Yeah.
you go through training and everyone talks about not using medical jargon and all these sorts of things. And, it does not take but just a few, weeks, days, months in practice before you catch yourself doing it. And so just that constant reminder of just talking to people as if they're a person and not a disease.
Yeah, absolutely.
Yeah.
Well, thank you so much. Appreciate all the insight you brought to the conversation today and look forward to inviting you back on DX in the future.
Oh, it's been my pleasure.
Thanks.
Yeah.